Hi everyone, this is Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. We have here a patient who attended with a blocked left ear, and upon attending, you could sense that they were really distressed by this blockage. They were experiencing a lot of earache, so what we call otalgia. And as soon as I examined the ear, I noticed that this isn't an earwax buildup. Instead, they have a grade 3 keratosis obturans. And a hallmark of grade 3 keratosis obturans is what I'm removing right now. And this is some granulation tissue, which is developed within the ear. Granulation tissue is a buildup of connective tissue produced by the body in response to trauma. So it's sort of as part of the healing cycle. And this connective tissue also then has its own blood supply. Hence why when you remove granulation tissue, there's a lot of blood there. And what this patient had done with this plug of keratin that has failed to migrate, and instead it's built up in the ear like a plug, and it's expanded and widened the ear canal. You'll see that in a moment, is that the patient with the cotton bud has further traumatized their ear. They've pushed this plug really deep against the eardrum because they've also softened it. Normally with a keratosis obturans plug, they're very dense, very springy, very rubbery, and they're almost immovable objects. But the patient had been using drops for quite a while, so it was quite easy to remove in that respect, but they had caused a lot of trauma. And you can see in this midsection of the ear canal, the inferior aspect here, the patient's got a large crater, opening, widening, pothole, whatever you want to call it. And there's some ulceration of the skin, so the skin that lines the bony part of the ear canal has been breached, and it's left some of the underlying bone exposed, and the adjacent skin is quite inflamed. So we've referred the patient to their doctor so they can get some treatment for this to help the ulceration or help the skin reheal and the inflammation settle down. And it's very, very likely that this patient will now have to have their ears cleaned on a regular basis, because when you've got a crater like this, a pothole within the ear canal, skin that normally migrates out of the ear as part of the shedding process it's going to fall and get trapped in this crater, and it's going to be unable to escape, and it's going to again collect into a plug of dead skin and then develop into another keratosis obturans. However, I've also asked the GP to refer the patient onwards to see an ENT specialist just in case there's some underlying canal cholesteatoma. When you've got a crater like this, some of that skin that falls into it and gets trapped can harden, and it can start eroding into the bone, and it can lead to osteomyelitis, which is infection of the temporal bone. And this infection of the temporal bone can spread, and it can be very, very dangerous. It can affect the jaw, the skull base, the facial nerve. So I just want to be ultra cautious. An ENT specialist may decide to send this patient for a CT scan so they can evaluate the underlying bone. I've just bent the tip of the fine end. I'm just trying to go into this crater. The patient was finding it slightly uncomfortable. They were naturally a bit nervous as well because they were really, really suffering upon attending with this blocked ear, and so we do not want to add to any anxiety and pre-existing trauma. So I'm just being extra cautious, extra delicate, trying to remove anything I can safely as possible. You can see there's a bit of blood there that had stained the canal wall. So when I removed one of those earlier granulation tissues, the blood vessels ruptured within the connective tissue, within the granulation tissue, and then as I was removing it, smeared against the posterior canal wall. So I'm just mopping up near the entrance. So grade 3 is quite severe keratosis obturans. The highest grading is grade 4, and that's when the posterior bone, the back part of the ear canal, the bone is so widened that it forms part of the mastoid bone. This is the patient's right ear, and you can see they've got this natural divot anyway at the base of the ear canal. So again, this ear is very healthy. There's no trauma to it, but that crater, I suspect they've also had that. It's just an anatomical abnormality that the patient has with the ear canal, and in the left side, for whatever reason, the skin's got trapped there, and it's then developed into keratosis obturans. That's some granulation tissue that I removed. I've just taken a still image. Well, I hope you enjoyed that video, guys. Take care, keep well, and speak soon. Bye.